What if technology could give doctors superpowers and personalized care became the standard for everybody? This is Jonathan Kirstein with the Pittsburgh Technology Council and Tech Vibe Radio, bringing you healthcare reinvented with Highmark. In this episode, my co-host Audrey Russo and I are joined by two leaders at Highmark who are just on the forefront of healthcare innovation. We're talking to Mari Baker, Vice President of Health Strategy and Delivery, and Mari Vandenburgh, Vice President of Health Programs and Solutions. Together, they are transforming how healthcare reaches and supports nearly 7 million members. There are so many great reasons to keep on listening. First, discover how holistic care works in action as Maria and Mari explain how their teams collaborate to meet both targeted clinical needs and wide-reaching population health goals, creating a seamless journey for patients. Plus, you can learn how technology is empowering doctors and patients alike, from real-time program referrals to data-driven insights that enhance decision-making at the point of care, and also get insider tips to maximize your Highmark experience with advice for members, employers, and employees on accessing the benefits and solutions available through Highmark's innovative living health strategy. Don't miss this fascinating conversation on the future of personalized healthcare and how technology is shaping healthier communities today. So Maria and Mari, so happy to have you here in the Huntington Bank studios. We have the best conversations, and everything around healthcare reinvented gets Audrey and I super stoked. We love when we start with introductions here, Audrey. Is that not our thing?
Yeah, let's do it.
100%. So who's jumping in first?
Yeah, I'll go first. Hi, I'm Mari Vandenburgh. I am the Vice President of Health Programs and Solutions at Highmark. My team does product management over all of our clinical programs and solutions that target specific physical health or behavioral health needs.
I'm Maria Baker. I'm Vice President of Health Strategy and Delivery. So I'm the in to Mary Jiang. My team does all of the product management for health programs that span the acuity pyramid. So anything that basically anybody could benefit from, not specific to anything. We like to say that our two teams weave together in a fabric, because if we're doing all of the right targeted things and all of the wide-reaching things, they stitch together pretty well to bring holistic care to everyone.
You guys are like the M&M machine.
We are.
I love it.
We are.
We got the experts here today, Audrey. This is super cool.
So give us like an overview of what this Highmark living health strategy is, so that, break it down.
Yeah. Honestly, in the most simplest terms, living health is about improving health for everyone. It's about truly getting to the core of what people need in their entire health journey and finding the ways to break down the barriers that people feel when they're trying to get care. So most importantly, it's about treating the people like a whole person, not just the diagnosis or the particular appointment need, but stitching together all the various components of the healthcare industry that I think we all know can be rather clunky to navigate, and bringing it in a seamless, smooth way and allowing people to get what they need at the right time in the right place.
So can you give us like a use case?
Yeah. So I think first and foremost, to talk about use cases, it's important for us to anchor on whole person health. So like I said, it's not about the diagnosis, but it's the physical needs, the mental needs, and frankly, the social needs. So if there is somebody who doesn't have access to transportation to get to care, or somebody who, has trouble trying to find their way to the right specialist, being able to meet them with potential virtual care options, or being able to know that they're, waiting in line for an appointment that is more timely, and having someone proactively outreach to them to help them find something quicker, closer to them, easier to get to. Really about seeing more than just the need in the minute, and understanding what else that person's individual situation and the way they move through the world may require them to do.
So no matter how they enter the system.
Yes, correct.
So it could be one issue, right? And then you're trying to figure out what's the wraparound.
Yeah.
So does this include a lot of physicians, clinicians, social workers?
Yes. Yeah, it does. And, we're fortunate because we have such a wide footprint. We have a variety of different relationships in all of the markets we serve. Obviously, in Pittsburgh, we have the Allegheny Health Network right at our fingertips to have very, very deep clinician involvement, not only in the programs that Mari and I and our teams design, but in the ability to deliver those programs and know when a person would benefit from them. If they're at the site of care, they can make a referral live and help them get connected to resources they may not know they have access to.
So what about some data? What do we have some data, and what about the narrative about how many people got lost?
Yeah.
Yeah. Well, I would say, Highmark has members over all of our lines of business, and in our Living Health strategy and with the capabilities that we are creating with Living Health by leveraging technology and all of the data we have on our members, not just from what they have told us when they come into our digital experience and maybe complete a self-assessment, but what we can see from where they're seeking care, whether that's in a doctor's office, the emergency room, an inpatient stay. We get that data and we're able to take that in and build it into our analysis to create personalized recommendations for individuals. That's the spirit of what we're trying to build with Living Health, to get someone to the next best action for them to improve their health, whatever their personal goal may be. So that can come from a number of different sources of data, whether it's something they've told us, something we see in claims, a data point that we collect because they're leveraging some of the programs and solutions that our teams manage. There's a lot of engagement information that comes from people participating in these programs that tell us what's important to them, where do they prefer to receive care, and it's about Living Health is really about helping Highmark use technology to leverage that to make better experiences and recommend them.
So, do you see that, in the emergency room? The emergency room is obviously a default, right, where people are. So I would imagine you see all kinds of people who have all kinds of needs, whether they know it or not.
Right. And I think there's the emergency department such an interesting example because you can tackle that problem from a couple different angles. You can obviously intervene and help the individuals who actually go to the emergency department. That's the point when someone's crashing into the system and it's time to really sit down and dissect what they need. But if we're doing our jobs, we're also creating enough education and awareness upfront to what people have access to so that the emergency department isn't the only thing that they think of when they need something, because
you want to keep them out of there.
You want to keep them out.
Not the best
the
place
emergency
to go,
department is for
that,
emergencies,
right.
and so it's a surprisingly large number of people who go there because they know they can get care, or it's
the last chance.
It's the last chance, or it's the first thing that pops to their mind.
And
because
it's the most expensive.
And it is.
As well.
And, and often extremely long waits too.
And long wait, all the good stuff that makes you.
All the things that make your experience really, really good.
Exactly right. What I find amazing though is how this evolves with the patient. So once you're in the system, and I can actually speak to this personally because I had back surgery 4 years ago. I get notifications about what's available to me through Sword.
Yep.
And being able to, they'll send me an iPad and I can go through. Actually, I haven't taken care of that because I just do my own stuff. But knowing that I don't know how to do this.
I've done it for 2 injuries. It's fabulous. Would recommend it.
Those are the types of things that it knows, and so it follows you along. And I can think that's just great for someone who wouldn't have access or know how to keep my back healthy afterwards, to keep them from. I was in the emergency room 2 times because of my back, because it was not the place I wanted to go, but there was no other way. And have I had to go back for that? No. So that's what I'm saying. I can actually literally, that's why I love these conversations. This actually has impacted me personally.
You nailed it, Jonathan. And one of the physicians that we work with all the time is an emergency room physician by training. And he also says exactly what you just did. No one goes to the emergency room because they want to. Yeah. That is not a good experience. You're sitting there for hours, potentially in triage. If
12.
It's not, if it's not an emergency.
12 on the north side, man.
And, I'm glad you brought up virtual physical care. That's one of our solutions. Yeah. It's amazing. We've seen such amazing outcomes with it in terms of people reporting lower pain, severity of their pain that they're experiencing. The virtual physical care program has kind of 2 prongs. There's the virtual joint health program, which is called Thrive by Sword, that you referenced. Yes. They offer, basically pain management solutions for all of the major joints in the body. So knees, hips, shoulders, back, all of them. And as someone may be experiencing pain, whether that's because you're recovering from an injury or surgery, it's just something that's been nagging you ongoing and you want to just be preventative and get stronger. The virtual physical or virtual joint health program provides everyone with a tablet that you mentioned. It comes with computer vision technology and AI so that...
I want to get it now just to try it, I think.
It's actually fun.
You come in, they pair you with a virtual physical therapist who understands what your intake, your symptoms are, where you're experiencing pain, and they recommend a personalized plan of exercises. You absolutely should.
Yeah, well,
And, it is provided in a no-cost fashion to our members, which is also removes the barrier to accessing care. Physical therapy, if you're experiencing pain or looking for that, it's typically 2 to 3 appointments per week.
you've got to
over
drive there.
6 to 8 weeks to get long-term results. So the virtual physical care program really brings the convenience of accessing it at a time and place that anywhere you have the tablet and you have internet, you can do those exercises.
And what I think this tends to do, it solves these very opposing forces in healthcare.
That's right.
Of reducing costs and improving outcomes. It feels like you got to spend all this money in order to get someone better, but you actually are finding ways by using technology, being able to do things virtually.
Right.
It makes it cost effective for you,
Yeah.
but it also makes it easier for the patient. I mean, so all these things line up in a really nice way to where it's like, wait a second, man, people can get healthier.
And
you
it
track
happens.
that. Yeah.
It happens in a couple different areas. Of course, it's easier to deliver care and cheaper to deliver care if you do things in a virtual way or in a digitally enabled way. But also, if you can intervene early enough, like my flip side to your story is
Surely.
I had a shoulder injury that likely was going to have to result in surgery, and it was getting worse and worse. I, by nature of working in this space, knew that this was available to me and used it, and I never had to have surgery.
That's what I'm talking
Physical
about.
therapy virtually.
Yeah, it was through this tablet that Mary was just talking about. And so there's yes, it's cheaper and more and many times more effective to deliver care digitally and virtually, but also there's a cost avoidance component of it that if we can
100%.
intervene early enough and meet
And the shoulder would have
people,
put you out
would have
months,
it was
for months.
a blessing in so many ways. Yeah.
And for some people, that gets set off the chain of events that makes you worse. Because if
Yes.
you lose mobility, if your bed, I mean, it just
There are
feels
mental
like
health implications,
everything,
all of
right.
the yeah, absolutely.
Better get that.
But I'm okay.
I don't
though.
care.
But
I know,
keep it
I
okay.
kind of want to
It's
try.
about it's about
Okay,
prevention
maybe
and
maybe-
maintenance as well.
Because I get the reminder like every quarter or so,
Yeah.
and I'm like, maybe I'll do it because I know it's free. I'm just like, but but the idea that I'm using this advanced technology, maybe I could, beef up a little bit. Yeah.
I think
Well, the limping's going to happen forever, man. A dead nerve is a dead nerve. It ain't coming back. But whole other story.
Okay, we're going to start getting
If the limp gets better, you have to tell us. Send
The-
us a note.
Oh yeah,
Yeah.
exactly. I don't limp anymore. I would love to report that.
So do physicians in the Highmark system have access to all this?
Yes.
they do.
So when I get my physical,
Yeah.
that's all part of it?
It is. So we do a lot of outreach with our physicians. Obviously, because of our relationship with Allegheny Health Network, we have a lot more technology-enabled integration where when you might be with your doctor, if they're an Allegheny Health Network physician, at the bedside, when you're in that appointment, they have information in the medical record in Epic that shows what programs and solutions you may be eligible for through your Highmark benefits. We do a lot of outreach to our provider network through our teams to educate them on what programs and solutions we do offer. Now, I think the promise of living health and how we can all think about, technology improving, it would be amazing if all of our providers had that capability, but every health system has their own medical record system. So there's a lot of work to be done to really drive that technology deep integration.
But as a patient, we can be an advocate for it.
Absolutely.
Okay.
Absolutely. And Highmark does a lot of outreach to our members as well, directly to let them know when they're eligible for those programs. And that comes up very often in our digital experience called My Highmark, which we think of as our front door to accessing all of the tools to help you manage your health care, whether that's you're just investigating your claims, you want to understand what providers are in network or in your preferred tier of benefit structure, but that's also where you can get access to all of these digital and virtual programs.
It's like a dashboard.
Exactly.
Yeah,
There's
roll
an
it.
entire get care section so that, I think a lot of people, the immediate thought when you think about your insurance is my claim getting paid? Do I have the card so that I can make the appointment and can I find a doctor? But changing the model that people think of for healthcare to say, I also can go to my insurance to find more access to different programs and things before I have to be in front of a doctor in an office.
It's changing the whole use case of how we have viewed insurance for,
Yeah,
for
it really
a,
is.
a lifetime almost, right? The idea that I just love the idea of being so much more proactive with your health to keep your health, not just treat something when it goes bad, right?
Yep.
Well, what about, employers? How can we help? Because we have Highmark, right? And so what should we be doing in terms of educating our employees?
Yeah, I would say you should definitely work with the Highmark account representatives that work with you, because we actually develop employer toolkits that can be shared with all of the employees around what programs and solutions
okay.
that you've included in your benefit designs for the employees.
that.
And it provides, in addition to any direct Highmark communication to the member, it gives you a toolkit and a guide of this is how you can communicate to your members. This is some tactics that you can use to help promote and educate the benefits that are available to
I
them.
love letting people know, and especially with the breadth of services that are available, tools and stuff like that. One thing maybe if we talk a little bit more about is the mental health side of things.
Yeah.
I mean, fortunately, I'm just a big proponent of making sure everybody has great mental health, and it's really hard in this day and age. I think one of the positives of COVID was that it became okay to talk about it. There's not this,
100%.
try not to have this like scourge behind it. Tell us more about some of the mental health resources that are available through this whole program.
I'll take that one. So through my Highmark, and we offer our mental well-being solution powered by Spring Health. The mental well-being solution is really a comprehensive solution that addresses all levels of behavioral health needs. So anything from self-guided stress management exercises, one-on-one coaching or navigation support for finding behavioral health care. You can also access virtual or in-person therapy and medication management services through the mental well-being tool and the network of providers that it brings forward. And lastly, there's 24/7 crisis support, which is, of course, hopefully
Super crucial.
Yeah, crucial and very important. We've had some really amazing stories that came out of that.
I can imagine.
And so what's the best way, as people are listening, to access that?
Yeah. So I would start by, if you don't already have Highmark coverage, go to highmark.com. That's the first place to start learning about it. But if you are a Highmark member, downloading the My Highmark app, setting up an account, getting enrolled.
Get that on your phone.
Get it on your
do
phone. It is there. The Get Care tab that Maria mentioned will have that mental well-being tile that you can click on, and it will seamlessly single sign on you into the Spring Health solution. And what we're really proud about, Jonathan, you mentioned just it became okay to talk about mental health kind of post-pandemic. And, the average wait time to get support if you are seeking therapy nationally is around 48 days. And through our partnership with Spring and the mental well-being solution, people are being offered appointments for therapy, first appointments in less than 3 days.
That's what I'm talking about.
So when you're
That
at
is
that
huge.
moment where you're feeling, I need help and I want to do it now, you don't have to wait 6 weeks for that appointment. It's available soon. And, they have a great algorithm where, again, through an intake and assessment about learning about what you're feeling, what's important to you, they try to do some matching to
That's great.
pair you with a therapist that will be a good fit, because that's a crucial part of seeing better outcomes through behavioral health care, is building that trusted relationship.
It's also so interesting with the matching to the suggested partners in the experience. Sometimes it's not the right fit, and it's very easy to change and find
Excellent.
someone
Okay,
else.
so if it's not working, you can go and
Yep.
shuffle it around and
Which is a lot harder to do in an in-person therapy, because you feel you went through all this wait to get to an
Yeah, and
appointment,
you're
and
like,
you feel
"Oh."
so
And there's
committed,
still-
and
Good
if
point.
if the vibes are off, you don't know what to do. But it's okay if the vibes are off. You can very easily go
Just
back
switch
into
out.
the other
that's a great
recommendations and try and find
Try
the right
another
thing.
one.
Yeah.
It's such a personality heavy thing.
That's
too.
awesome. I mean, I feel like you're
And-
through the app and everything, you're building this ecosystem that's just making it so much easier for
Absolutely.
people to fully manage their health. Not just, something hurts, I got to go to the doctor, but it's like, keep that from becoming something crazy.
Yeah. And the quality of the care they receive in those digital and virtual solutions is very important to us. So we were just talking about mental well-being.
Yeah.
We see really high quality outcomes coming from the providers that are supporting that solution, where if an individual comes in and they are screened and they indicate they have moderate to severe anxiety or depression, we are seeing remission of those symptoms in sometimes less than 6 sessions.
Really?
So
Okay.
having someone go from feeling in a really low or very overwhelmed place to in a couple weeks time
Pretty miraculous.
is miraculous, to think about the, again, impact we're having on their health and the other ramifications that we were able to prevent and avoid potentially worse things happening because they got the support and care that they needed.
That's what it's all about.
So
Yeah.
some of the programs that I'm reading about, and if you go to My Highmark, are obviously mental well-being, which we talked about, Spring Health, virtual joint health, which we alluded to.
I know that well. I get the envelope.
Sword.
Yes.
Yeah.
Thrive by Sword. What does that mean?
That's the name of the program for that virtual
Yeah.
physical care solution that focuses on joint pain.
Oh, that's for joint pain
Correct.
too. And then
Sword Health has another arm of the virtual physical care solution that's focused on pelvic floor.
I saw
health
that.
you
So
might
there's-
be getting
right.
to. Yes.
and then there's Bloom by Sword.
Yes. So that's the virtual pelvic health solution. It's called Bloom by Sword, the way that they market the program.
Interesting.
But it is a virtual and program that much if you experience joint pain, if you're experiencing symptoms around pelvic floor issues,
Right.
you can get paired with a virtual specialist for pelvic health. And instead of a tablet, they actually send a device that is optional to use, but it's an insertable device for individuals with vaginal anatomy that can
Wow.
help sense in real time as you're
Wow.
doing the
You serious?
exercises. As you're doing exercises, the strength, the endurance, the accuracy of the exercises, and send that feedback to this virtual pelvic floor, or the pelvic floor specialist so that they can modify the program for
That's
you.
got to be super life changing. That's something where it's but you can
It
do
is.
that like at
And
your
that's
house.
usually
Yeah.
ignored
Right.
until
So
that's
that-
a very
Noom.
severe.
that-
And then you're going to have Noom.
Yes, we will. Noom.
Noom
How cool
launches
is
on
that?
1/1. We're very
Yes.
excited about that one.
Yeah.
And, very similar to the mental well-being conversation, Noom is really about creating access to something that everyone can benefit and use.
Right,
It's
absolutely.
weight management and weight health is such an underpinning to so many chronic conditions, but it's also such an input into mental well-being. It's an input into basic physical health, even if you're not in a chronic condition. So we're very excited to be partnering with Noom.
Wow.
I mean, so much is happening at the same time, and I'm always amazed as you integrate the stuff, you get it out. And I know the adoption rate on the app has been pretty amazing as you launched that a while ago. And you've been seeing more and more people glob onto that because they realize that it works. I mean, you've created this ecosystem. Are like other health systems looking at you guys being like, how did you do this? Can we copy this? And I feel like you've built something very special and unique in the marketplace.
We do have a lot of partnerships that are relationships elsewhere in the Blues network that we talk to a lot about what we're trying to do. And, I think there's, in general, an interest in creating more access points, but the industry has always looked at them as very point solution. Well, we'll turn this on and we'll turn this on and we'll turn this on. And what we're really trying to not just differentiate for ourselves, but for everyone who has to struggle through healthcare on a daily basis is that they will connect and talk to each other. And so
what it's
that's
all
going to be
about.
the ultimate end game is every time we introduce a new program like this, how can we find ways to make sure there are multiple roads to get there? And doesn't matter what need you're tackling right now. If you need this too, it will get pointed to you in some way, shape, or form.
One of the best things Audrey and I have done, Audrey and I, we've been doing this podcast with Highmark for 7 years now. We've really watched a lot of the evolution, which has been, we got this like front row seat to see what you guys are up to. It's been so much fun. I can only imagine what they're working on next, Audrey. Like, there's a whole thing. Yeah.
Or right.
Yeah, exactly. Oh, they're working
It's on the list.
It's on the list.
Very much on the list.
Device
My
integration is on the
PCP,
list.
who's a Highmark PCP, looks at my data.
Yeah, which is great.
How about that?
That is amazing.
As they
and
should,
remarkable.
I mean, there are a lot of the whole device space is very, very interesting. Not only are there so many of them, but it's also about getting the customers comfortable with sharing the information.
I
because
share
the
it.
more informed we are, the better we can personalize to you. And so it's a two-sided battle of getting the data, but also getting everyone comfortable with sharing it.
Can you talk? Oh, I'm sorry. Can I add one thing? Of
course.
You talked about what's next. Technology is evolving so quickly around us with artificial intelligence and other predictive modeling capabilities that come from that. The ability to take all of this vast amount of data about your health, about your clinical experiences, and bring that in and really synthesize it, understand it, and then say what would be the next best thing is something that, we didn't have a good capability to do that. So this is where we're seeing technology really starting to be a key player in transforming healthcare so that you can focus in your all of your time on the most important interactions with your doctor. They're not digging through pages and pages of report. The technology can say, oh, I analyzed all of the trends for Audrey. Here's something that was unique that you should really talk about today in your appointment. They would have had to prep 20 minutes, flipping through all of that data.
It's giving
Totally.
docs superpowers
Fantastic.
now.
It is.
And
It
it's
really
not just
is.
substituting them, but it's becoming a tool for them so they can be a better doctor.
Yeah, freeing them up to actually be a doctor and not be
Right.
part doctor, part administrator, which is
Yes.
Right. So as
Quite a
we
bit.
wrap this up, fascinating conversation and so informative, where should people go? Okay. If you're not a member of Highmark, obviously go to Highmark Blue Cross Blue Shield.
Yep.
If you are an employer, you can have people come in and talk to your employees
Yep.
about all these benefits. And if you are an employee, who has Highmark, they can go to
My Highmark.
my Highmark.
Download the app and get
So it's
your
not
account
through
set up.
my chart. It's through my Highmark.
It's through my Highmark.
Yeah.
Yes, because not every provider system uses my chart. My chart is an Epic product, so in their medical record system, there are capabilities in my chart where you can get access to your specific doctor.
Right.
We are really meant to sit above that, so that
Okay.
you as a member know everything in the sphere that you have access to. It's, as Mary talked about, it's really important that the doctor also knows what you have access to.
Yeah.
But there are people who live in areas that don't have my Highmark or don't have my chart access,
Isn't that
or
great?
doctors these
So
days.
That's right.
Thank
yeah.
you.
I can actually go into I have the app on my phone. I could open it right now and get my Thrive if
Yes,
I
you
wanted
could.
to.
You
I
can.
don't have to wait for the yellow letter.
I think
You
you
don't
should
know.
get it.
I want to try it out.
With single sign-on, it's seamless. It'll be
exactly.
there in a few days.
Yeah.
Very cool. I mean, what a fun
That's
conversation.
great.
I don't
Thank
know.
you
We
for
just
your
love
work.
this stuff. It's amazing work. And the best part is it's all coming out of Pittsburgh, for crying out loud.
Yes.
You guys are leading the way and keeping us healthy. Thank goodness. Great stuff.
And I think feeding into that, the more we keep Pittsburghers healthy, the more innovation we can all drive. And
I like
it
the way you
becomes,
think.
It becomes a upward spiral
Healthy,
of benefits.
Drive innovation.
That's
Yes.
right.
I love that.
That would look great on a T-shirt.
Yeah, the tagline of this episode. I love it.
I'm always thinking about T-shirts.
He's always looking for swag.
Yeah.
I wear a size large. So yeah. Yeah, thank you so much for joining us today.
Thank you for having us.
Thank you for having us.
Great conversation. Hey, if you want more conversations at the intersection of healthcare and technology, as I mentioned before, we've been doing this for a long time right here on Healthcare Reinvented. It's been Jonathan Kirsting,
And this is Audrey Russo.
and we look forward to seeing you on the next one.